I've been interested in child and adolescent psychiatry for as early as I can remember. And I think what really confirmed it for me is I had an opportunity to work in a program called the Summer Treatment Program, which was essentially an 8-week evidence-based treatment program that had a lot of therapeutic interventions incorporated into a summer camp for kids. That and prior to going to medical school, I was a behavioral specialist and worked at a high school with children who have autism. And both of those opportunities really gave me a sense of what it's like to be a caregiver for a lot of these kids and spend essentially the whole day with them and see how different medication changes and therapeutic techniques made a difference in their academic life and their social structure. Now being a physician and being on a different side of things, I still get to work with a lot of the same children that I have a pretty big passion for. While I was in medical school, I worked in a program called the Patient-Centered Medicine Scholars Program. And within that program, I worked with a lot of women who were exposed to domestic violence. So I was really responsible for seeing them in a primary care setting in addition to going out to different shelters that they lived in and teaching them different important medical lessons that have to do within primary care, teaching them about chronic pain, teaching them about mental health. And one of the things that we incorporated was pretty regular yoga and mindfulness sessions. And a lot of the women would tell us that their chronic pain got better, their migraines got better. And so we really focused on the importance of talking to people about whether or not they've been exposed to violence and really feeling comfortable having those conversations with people. As a psychiatrist, this is something that continues to be pretty important because a lot of our patients are pretty vulnerable, have been exposed to lots of trauma in the past, and really that opportunity continues to feed into my life today, just in thinking of meeting patients where they are and understanding and trying to be empathetic to things that they've experienced in the past. When deciding on what sort of residency I wanted to pick, there were 3 primary things that were important to me. One was going to a place where I felt like I would have really good educational opportunities. The second was wanting to be in a city that I felt like I would like living in. And the third was having coworkers and colleagues that I enjoyed spending time with and that I felt like I could learn from. And that was something that I felt UW had all 3 of. In terms of our educational opportunities, I think we have really good exposure to inpatient, outpatient, psychotherapy, consult liaison, in addition to emergency psychiatry. And I found that a lot of the psychiatrists that work to train us are very smart yet humble people and really treat us as colleagues, which is something that you don't necessarily find across other specialties in medicine. Madison's a great city to live in, and I think in terms of the coworkers here, I find that we all are pretty empowered to make a difference in people's lives, and you're going to work with people who are essentially just as hardworking as you are, and also the same people that on the weekend we can decide to go apple picking together or go to the bar together or concerts on the square or anything else that's happening in Madison. I'm originally from Chicago, Illinois, so moving to Madison was obviously a little bit of a change for me. One of the things I did actually was decided to live downtown. Downtown Madison is great because it really made me feel like I was in the middle of the city. I was really close to a lot of things that were happening, a lot of exciting things that were happening. I personally have loved living downtown since I've gotten here. I love being a 2-minute walk from the Capitol, walking distance to the Dane County Farmers Market, Art Fair on the Square, concerts on the Square, all the things that are happening downtown are pretty close to where I live. And that's an experience that I never really had in Chicago. A lot of things in Madison just tend to be really easily accessible. You don't have to worry about driving long distances to get to them. You don't have to worry about paying lots of money to park once you get there. And so it's just easy to get together and do things with people. Lots of good restaurants, lots of fun things to do outdoors, especially in the summer months. So people who like hiking and kayaking, and lots of bike riders here as well. So I'd have to say all those things really incorporate the reason I like Madison, and my favorite things about being here is just knowing that all those things are really, really accessible to me. So in the long term, I definitely see myself working in academic medicine. I've really loved my experience on the inpatient unit, the consult liaison service, and emergency psychiatry. So I somehow see myself definitely working in a hospital-based setting. I love the acuity of patients. I love really being able to incorporate psychotherapy and even some of those short interactions with people. And I really like watching how physical illness and mental health are associated together, which you really get an opportunity to see when you work in the hospital.